Good evening, everyone. Sorry, yesterday the class got cancelled. So I'm pretty sure all of you have tried the OSCE discussion. We've done 15 stations. So I hope everyone's gone through it and tried to answer it. So today we'll try to briefly solve it. All the questions, I'm pretty sure they were easy. Most of it at least was. So before we go into the OSCE questions in itself, I'd like to tell you a little bit about how the DNB OSCE format is going to be. And most of my knowledge on this is based on last year DNB exams. I've asked a lot of people about how their exams went, and this is how they told me that they had 15 stations, sorry, they had 20 stations that they were given. And all stations were basically displayed on a screen. Every center was given the same screen, the same time all the questions came on, and it was run from the NB center. So you had basically 20 stations, 5 marks each station, total of 100 marks for each station. This is a change from the previous DNB exam. So there were 20 stations, 5 marks for each station, and total of 100 marks was given. And some students told me that they were given 3 minutes per station. Some told me it's 4 minutes. So there's a little discrepancy on that, but basically 3 to 4 minutes will be allotted each station, and the time allotted will also be displayed on the screen. And you will be given a short break after 10 stations. Okay, so this is how it is. And most of the questions are going to be either clinical scenarios or images or specimens. Sometimes they might give you videos of gates, or clinical tests can also be given. So these will be few of the questions that you can predict. Now let's move on to the 15 stations that we had prepared. So I'm pretty sure most of you answered this. So we'll quickly go through this. So this was the first question. And the reason I gave it in 2 slides is because this can happen in your DNB exam as well. You'll be given 2 stations, 2 slides. In the first slide, you'll be given an image, and later on, you'll be given the questions. So can anyone tell me what this image is? What is it trying to depict? You can answer it in the chat box. Anyone? What is this depicting? So I'll go into the question as well. So these were the questions for this OSCE station. Yeah, Dr. Shankar says it's cutting cone and bone remodeling unit, HG. Okay. Anyone else with a different answer, or anyone else like to agree to these? So the first question is name the structure. So that's what I'm asking. What is this image? What structure is this? Okay, both of you are right. Shankar, you were right. The answer is a cutting cone or a bone remodeling unit, mainly called as a cutting cone. Now, role of the following structure was another question. Can anyone tell me what is the role that this cutting cone plays? I was basically looking for two answers. What are the 2 functions that a cutting cone does? Primary bone healing. Okay, in primary bone healing, I'm pretty sure you heard types of primary bone healing. In which, how does it act? So it acts differently in both types of healing. Can anyone tell me what are the types of primary bone healing? Cortical bone. Okay, that is not the complete answer. Endoscopy. No, I was looking for what are the types of primary bone healing. Okay, you're confusing a lot of concepts. See, basically, in primary healing, there are 2 types. There is contact healing and gap healing. How does it act? And there is also secondary healing. So how does cutting cones take part in these 3 types of healing? So someone already told me that bone remodeling unit. So cutting cone takes part in bone remodeling. That is one thing. Second thing is it helps in direct bone healing. We established that this was a cutting cone. The second question was, what are the roles of a cutting cone? So someone told it was bone remodeling. So that is the right answer. The second one is, see, there are 2 types of primary healing. There is gap healing and contact healing. In contact healing also, this plays an important role. Okay, so that is where in primary healing it takes part. So 2 things we've answered. We've answered this, we've answered here. Now, what the third question is, identify the components present in the structure and then tell me the origin of those cells. Anyone would like to attempt this question? What components do you see in a cutting cone? So let me put the image of a cutting cone. What components are present? There's an osteoclast, correct? There are these are osteoclasts which are present here. Right behind the osteoclast, what else do you see? Osteoblast, yeah. So around this region here, you will see osteoblast. Any other structure you might be able to see? These resting osteoblasts are called as, yeah, Umesh, you're right, it's osteoblast. And what else? Osteoblast, osteoclast, and what else will you see? What other cells are seen? See, along the lateral area, as the osteoblast goes into resting, you can also see osteocytes. You can also see osteocytes. So this is how they look. Usually a bone remodeling unit looks like this. There is presence of osteoclasts in the front, which resorb the bone. Then there are these trailing osteoblasts, which lay down new bone. And also in the peripheries, you will be able to see osteocytes. Now, can you tell me what are the origin of these cells? How are osteoclasts formed? From which cells are osteoclasts formed? Quickly, these are one-word answers. Okay, correct. So macrophages. In my anything in specific, which type is it seen more commonly in? Mesenchymal stem cells is not the answer. You're talking about osteoclasts or osteoblasts, Umesh? We're talking about osteoclasts first. Okay, so osteoclasts mainly are from monocytes. Okay, yeah, monocytes, correct, SG. So osteoblasts now. Tell me, how are osteoblasts formed? Anyone, how are osteoblasts formed? Okay, no one is answering this, so we'll move ahead. So these are things I've already covered in basic sciences. So this is how an osteoblast is formed from a mesenchymal stem cell. With the help of BMP, osteoprogenitor cells are formed, which later give rise to osteoblasts. And along with that, they produce alkaline phosphatase, type 1 collagen, osteoprotegrin, and Rankel ligand. I won't go into the detail of the slide, but understand that mesenchymal stem cells are the origin of an osteoblast. Similarly, osteoclasts are formed from hematopoietic stem cells, monocytes. They are of macrophage lineage, and once an osteoclast forms, we know how it functions. With the help of Rankel and OPG, osteoprotegrin, they activate the cell, give it a ruffled border, which will then go and cause osteoclastic resorption. So this is how osteoclasts are formed. So the answer here, mainly the first thing is cutting cones. It is helpful in bone remodeling. It is also helpful in primary bone healing, contact healing. Osteoclasts are formed by monocytes, hematopoietic stem cells. Osteoblasts are formed from mesenchymal stem cells. And the last question was, which is seen in abundance? So the answer to that is osteocytes. Osteocytes are the cells that are seen in abundance. So this is OSCE 1, the first station. Now let's quickly move on to the second station. Here you were given an X-ray, and the questions were, what is the diagnosis? What is the sign here? What classification system do you use? And enumerate the treatment option for such